Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out, or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. Today, I'm excited to speak with Dr. Melissa Sundermann, who is also known as Dr. Outdoors. She is trained as an internist and lifestyle medicine physician and is passionate about spreading health and wellness. Over her career, she has had a variety of experiences, from creating a lifestyle medicine consultation service at a large health system to a concierge style practice focused on promoting longevity. So whether she is seeing patients, creating programs, running workshops, or giving lectures, she takes an integrative, holistic approach and believes in nature as medicine. Melissa, welcome. I am so happy to have you here today.
Well, thank you so much for hosting me today. I'm excited for our conversation.
Yeah, me too. And when we first met, we first spoke, I was struck because you mentioned to me how you feel like you found at this stage of your career that you found your true purpose in the work that you're doing today. And while I know that your purpose won't be everyone's purpose, although to me it resonates very much, I love what you're doing, but it won't be everyone's purpose. I was hoping to hear a little bit about your career journey and your exploration as a way of, with the gift of hindsight, sort of to see the pivots and, along the way, how it unfolded for you.
Absolutely. And I think the hindsight, right? As we say in medicine, medicine hindsight is, 2020. We use that metaphor a lot. But when I look at where I am today, and I go, wow, like it's been a journey. And sometimes you don't understand the pathways that life takes you. And then when you get to a certain point, you look back, you go, oh, this all makes sense now. I'll say, like, one of the biggest things is my medical degrees. I'm a doctor of osteopathic medicine. So I went to Michigan State University for medical school, University of Michigan undergrad. And so I have a DO as my credentials. And fast forward, 30 years after medical school, and now my DO also stands for Dr. Outdoors. So it's like, how could that, I would have never imagined that. And now it's become this wonderful play with initials so that's just one example. But yeah, we went into medicine, I think, because we had this interest, this curiosity, and I didn't come from a family of medical providers at all. No doctors, no nurses, no PAs. It was just something that I fell in love with. And I think that just not setting a hospital setting, I thought, this is the direction I want to go. And like you said, I'm board certified in internal medicine. I think that being trained as a DO, in the state, we had both an MD program and DO program. So all of our sciences, all of our basic core sciences were all together. I think then becoming a DO, trained a little bit more holistically, just to think about the body as an integrated system. And I've carried that foundation with me throughout my career and always had a question in my mind, both personally and professionally. What is true healing? What does wellness look like? What does wellness feel like? And did self-exploration and pursued opportunities to learn more about what that looked like. And in conventional medicine, medical settings, right? So I'm in Ann Arbor, Michigan. I worked for the University of Michigan. Wonderful institution, amazing medical system, but very conventional. However, there is an integrative medicine department within the University of Michigan, and each year they ran a faculty scholars program in integrative medicine. So I was cohort in that cohort back in like 2007, so a long time ago. And what we did was we spent the academic year learning about complementary and alternative ways of healing. Not that I was trained in how to perform acupuncture or how to perform Reiki, but we met with practitioners who practiced these complementary and alternative therapies so that I could learn firsthand more about them. And so if I had patients who were interested in that or were utilizing that, I knew what it was about. And
Hmm.
that just opened my eyes and my heart to, wow, like a lot of these ways of healing have been around a lot longer than conventional medicine.
Yeah.
And really just being open to that. And I think that throughout our training, much of our training is very myopic, right? We have to, like, we learn from when we're in medical school, we learn from our instructors. Then when we're the third year, we start our rotations, we learn from the fourth years. And then your fourth year, you learn from your junior residents. And, so we're always learning from those ahead of us, which is wonderful. I had so many amazing mentors, but it could be very myopic in staying in this lane. And so when I did an integrative medicine faculty scholarship program, it sort of opened the horizon to what this could look like. And then took it a step further and did a professional training program in mind body medicine through the Center of Mind Body Medicine with James Gordon. Incredible experience, an experiential program. And Dr. Gordon is still doing wonderful work, really transformational work all over the world, dealing with trauma. And so that was, pretty early in my career. And again, in a conventional medicine setting. So it's not, I try to take the skills and the tools that I had learned and incorporate that in the conventional medicine setting. It wasn't always perfect, and I was a hospitalist for several years, so pretty hard to, sometimes do that when you're taking care of a patient in the ICU, right? So, but
Right.
just always having that knowledge base and wanting to learn more. And I am a mom. My kids are now in their 20s, but those were years that many of us who have a family and are physicians, it's that juggling, right? And wanting to pursue my professional goals, but also love being a mom, right? Still love being a mom, and my kids were into sports. And so there was several years of just trying to get through your day, right?
Yeah.
And uh and doing the best I could. And then my kids went off to college, and I thought, oh, okay, I have a little bit of room to breathe and a little bit of room to be more selfish, in some senses. Selfish meaning that family comes first, and my kids, and making sure they were okay. And I knew they were getting their wings. And so I found out about the American College of Lifestyle Medicine, and it resonated very deeply with how I had already been practicing. But I
So
felt
had you
like
been practicing,
now I
Melissa,
have,
had you been practicing all this time in a hospital setting, in an inpatient or outpatient or
yeah,
combo?
and outpatient, I sort of would go back and forth between outpatient and inpatient. And remember, as internists, it's changed now, but we
Yeah,
did both, right? We would
yeah,
round in the hospital in the morning and then go to the office in the afternoon. So that's how I started out. And
right.
then the hospitalist became its own specialty. So I would
Yeah,
do
that really
outpatient
has
for a
changed,
number.
Melissa. Isn't it amazing how
Yeah.
much that has
Yeah.
changed? Also,
Oh, yes.
before you go on, I just want to comment that I really I I'm so I'm actually somewhat jealous that you had this experience so early on, this integrative I think I feel like I had a very myopic view for so many years with the traditional MD training and kind of all
Yeah.
the steps I took. It took me many more years to kind of see how much more there is out there. The mind body, the integrative. So good for you. You really lucked out on that part of the journey.
Yeah. And again, I think as a DO, I've had every opportunity that I've wanted in my career.
Hmm.
However, that being said, 20 years ago, like when I started working at the University of Michigan, the department I was in, I was the first DO they hired, right?
Mm.
So they kind of thought, does she have three eyes? Does she, what's
Yeah,
is she going to be as good as our MD colleagues? So, I was again, like
yeah,
everything that I've wanted to accomplish, I've been able to, but there was always this like, okay, are you going to be just as good as the MD colleagues? And
for sure.
fortunately, nowadays, I really don't feel that stigma, that, his DOs have proven ourselves. So I think that maybe that spurred me to be like, hey, already feel like a little bit of an outlier. So let's just
Yeah.
go with this. And,
Mhm.
and again, just showing up with a mind of curiosity and just, and wanting to learn more.
Yeah.
Yeah. So I didn't know about lifestyle medicine until 2018. And, like you said, I had worked for a university setting, and then I was part of large healthcare system for the majority of my career, in the Michigan area. So, um, everyone changes names, but
Right.
Trinity Health was one of the major ones, and they're throughout the country, so they're a large health system.
Mhm.
So I became board certified in lifestyle medicine in 2019, and that for me has been really one of the best gifts, because it has provided other physicians who are like-minded like me,
Mhm.
and we are riding this wave of shifting this paradigm from a sick care system to a well care system.
Yeah.
And I feel like everyone, my colleagues in lifestyle medicine and beyond, those of us who are just like, we're not satisfied with the current healthcare system.
Mhm.
Let's really talk about root cause medicine, and let's start more downstream than of what true prevention is, right?
Yeah.
True prevention. Yes, colonoscopies are important. Yes, mammograms are important, and low dose CT scans for our smokers. However, that's early detection. Like,
Right.
we're going to go more, upstream. I said downstream, more upstream of that to
Mhm.
what true prevention is. So the American College of Lifestyle Medicine, we have probably about 5,000 physicians who are board certified in lifestyle medicine. Big number to me because I know so many of these, but when you look at how many hundreds of thousands of physicians are out there, like,
Yeah.
we are a really small piece of the pie.
Where do they
And
largely come from? What specialties?
well, I mean, across the board, I would say a lot of primary care, right? So a lot of family medicine, internal medicine, OBGYN, but we're talking cross specialty, right?
Yeah.
Cardiology, psychiatry, rheumatology, nephrology. I mean, every single
Mhm.
allergy, immunology, pediatrics. And then also to be board certified and a member, you don't have to be a physician. You don't have to, you can be a PA, you can be a nurse practitioner, you can be a health coach, you can be a
Mm.
nutritionist, you can be a physical therapist, you could be a researcher. So in that certification process, so it really is all about the whole healthcare system of really having this mindset and how an approach to true prevention.
You mean to be a
And at the time when I
member, you can be a member as those things,
remember,
but not board certified as those. You have to be a doc.
so we have as a physician, my credentials are a diplomat of the American Board of Lifestyle Medicine.
Uh-huh.
Anyone can be a member as long as you have a master's level.
Hmm.
Master's level degree, you can become a member for like $250 a year. You can sit for the exam if you're a non-physician. However, your credentials will be diplomat of the American College of Lifestyle Medicine.
Mm.
So it's a little bit different test. And so your alphabet soup is a little bit different if you're a non-physician. However, we've got board certified lifestyle medicine practitioners
Yeah.
from, other disciplines.
Before you go on, and I want to hear more about this, but I wonder in your 5,000 people who you know, because there are a lot of people who are in without the lifestyle medicine certification who really do want to focus on all the things that you're saying, prevention
Yeah.
and the system makes it difficult to do that, the way the incentives and the pay
Yes.
structure. Do you have any members who are in maybe value-based care regions or regions where it's financially sustainable to practice this way without being concierge?
Right. So I think that is like the biggest question, right? Is how can we make this sustainable? And for healthcare systems who try to implement this, because you're absolutely right, as primary care and billing codes go, um, you know, you can crank out 4 patients an hour and bill at a 99214.
Right.
And then a lifestyle medicine consultation, really, you're looking at 40 to 60 minutes, because that's how long that takes to get a full history and the counseling that goes along with that, versus seeing 1 patient per hour
Yeah.
and billing maybe a 99215. Now, there are some ways that you can get around billing and coding for the added time, or that you're, counseling specifically about weight loss. So there's ways to boost that. So I think that we are starting to see shifts now. Blue Zones Health was just recently launched. And so I think they're really going after how to take a lifestyle medicine approach and make this financially viable. When I was with Trinity Health, what we were able to do is a couple of colleagues in primary care became board certified at the same time. And one of my colleagues, who's a mentor of mine, Dr. Bob Brakey, had been with this group since its inception. So was very well regarded and had the respect and just really knew how to work things within the system. So what we did was we put our heads together and we came up with a lifestyle medicine consultation service. And we needed to get buy-in, of course, from leadership. And again, it's like, I think always trying to show the ROI, right? If we can, get people off of medication, if we can, reverse their type 2 diabetes or get them off their hyperlipidemia meds or hypertension meds. Now, again, that's interesting with the coding because it's like our healthcare system, we don't want people to die, but we don't want them to be completely not needing our services. So we kind of like to keep them right in between where they need that stent, right?
Right.
Like don't get them so healthy that you reverse their heart disease because like we need to make money. So we came up with this model of a consultation service and built it out. And so what that was those of us who were board certified in lifestyle medicine, and there was about 4 of us in this huge group of about 1,000 providers, that you could refer your patient to us, and they're still your patient. However, if they have a diagnosis of poorly controlled type 2 diabetes, hyperlipidemia, hypertension, obesity, coronary artery disease, chronic kidney disease, we'll do consultations, and we brought in nutritionists who were aligned with lifestyle medicine as well as a health coach. So we would perform an initial consultation, which is about an hour. And then they would be hooked up with a health coach that would follow up weekly. And then at about week 4, we would see them back. And we're, getting my biometrics at the initial. So typically, I do a lot more testing now in my concierge role, but really what any conventional medicine doctor could track for this is, your basic metabolic panel, looking at fasting blood sugar. I think fasting insulin is always really important. A1C, C-reactive protein, lipid, looking at lipids and, just tracking those in BMI. And if you've got access to like a DEXA for body composition, visceral fat, total body fat, even an in-body exam. And so tracking that. So we would see them at like week 0, week 4, week 8, and health coaching in between, just for accountability and, touch points, and giving them resources. And that, we got good support from leadership to be able to do that. And now that was not my full-time role, right? So my full-time hat in this healthcare system was a primary care physician. And then I would have some protected time to be able to offer the consultation service. And, that's really where it started. And I think that's where, as a primary care physician or as a physician in a large healthcare system, you can look at maybe models like that. And then I built out also a lifestyle medicine interest group. So this was open to anyone who worked in our healthcare system. So we had about 3,000 employees, that once a month we would have a Zoom webinar, and I would bring in speakers from anywhere who were lifestyle medicine aligned, and they would give a talk. And so that was just a way to raise awareness across our healthcare system of what lifestyle medicine is.
Yeah.
So not only would they be aware for our patients, but then also for themselves too, right? Because this is about employee well-being and wellness. Right. And we were able to, at onboarding or orientation for our healthcare system, that was part of their onboarding, their orientation, is that they were introduced to lifestyle medicine and the pillars of lifestyle medicine. And we did a couple of experiential things, whether that was stretching, whether that was some deep breathing. So making that part of the onboarding process as well. So I think that those are some feasible things that if someone's looking to get started in this. And now once I got a taste of it, that's when I made the decision to keep going on with pursuing my passion for lifestyle medicine and
Yeah.
sort of taking the
All
reins
right. I
off
want
and
to
just
hear
going for
I
it.
want to hear where you went with it, but let me first ask you, your passion, it's, I can it's palpable, right? Your passion for this is really, and when your main gig job was typical primary care, let's say,
Mhm. Yeah,
and I imagine you try to bring this to all of your patients, and
yeah,
most people don't want to really engage in this. Most people,
yeah,
right? So,
yeah.
were you at odds with your day to day?
It's
You know,
interesting because I remember sitting when I was studying for my board exam, and colleague we were charting, we had cubicles, and he said, "Why are you doing this? Patients aren't going to change. They don't want to change." And I said, "I don't believe that. I don't believe that. I don't think we give them that opportunity." And through no fault of our own, we are not taught this in medical school or residency.
mhm,
We're probably, I don't know how old you are, but I bet we're about the same age. And
mhm.
nutrition in medical school, I'm like, did I even get any? I think it was under the form
It's
of
one
biochemistry and it
class,
preps. Yeah, yeah, but it wasn't practical nutrition. Like I
right?
didn't know anything about that. And then exercise is medicine. I didn't know anything about that. Sleep is medicine. I didn't know anything about that. So we're not trained in this. And unless we seek out our own training, um, maybe for ourselves, and then we
Yeah.
can bring it to our patients, because if they've done studies that if a physician exercises themselves, they're more to prescribe exercise
Yeah.
prescriptions for their patients. So I
It's
feel
funny
like
that
what
you just saying this because I'm realizing that even though I had no nutrition training,
Mhm.
my mother was a registered dietitian, and to
Okay.
her, um, everything could be fixed with food.
Yeah.
Right?
Yeah.
And I
Right.
realized, like, oh, I guess I did sort of have a training because that's really become like, okay, you have a sore knee, go have some pineapple. Like,
Right. Yeah. Right. But you didn't learn that in
yeah,
medical school. You learned it from your mom, right?
right, right.
So, I think that we weren't taught this, so it's not our fault that most of our colleagues don't think this way. A pill for
Yeah,
every ill, right? And we're
yeah,
very reactive. We wait until disease starts and then we treat it. And so what I found, surprising or not surprising, is that once you open this door, like if I've got a type 2 diabetic or someone living with type 2 diabetes, and I say, "Did you know that we can actually reverse this?" And they go, "What? No." Yeah, yeah. Let me tell you about a patient I had and what we were able to do and I said, "This is a partnership. Like, I can't do this for you."
mhm,
And, it's easy for me to write you a script and just give you the pill. It's easy.
yeah,
What I want to do is going to be harder work for both of us. But if you're willing to learn and put in the effort and, have a goal of, God, I would love it if I didn't have to take so many pills. Great. Okay. I would love it if I didn't have pain in my knees all the time when I'm walking around. I would love it if, my grandkid really wants to take a trip and go for a hike. I would love it if I could do that with them. Like
yeah.
finding that why is
Hmm.
really important. And, beyond, yes, like the number on the scale, beyond like, oh, I want
Right.
to fit into this old pair of
Something
jeans.
meaningful like going with
Yes.
their
So that,
grandkid for sure.
right. So that using, motivational interviewing and these kind of things, again, this takes time.
Yeah.
So once I made that shift of people don't want to be sick, they really don't.
Yeah.
They just don't know a better way. And I think it's also reframing because we take a family history, and so often I hear, well, I'm bound to be diabetic and
Right.
I'm bound to have a heart attack or a stroke because everyone in my family, that's what they get.
Yeah.
So it's in my genes. Reframing that as you're absolutely right. Genes are important, and yes, you carry genes from your parents, your grandparents, your ancestors. However, genes are not your destiny, and actually, genes are only responsible for about 5 to 10% of your health outcome. That means about 89% you have the power, and lifestyle changes can shift that and give them just a little bit of touch about epigenetics. You know what that
Mhm.
is like your
Yeah.
genes it's like a light switch, can be turned on or off. And let's turn those genes off so they're not expressing.
Yeah.
However, this is, and and lifestyle choices really can shift that needle. So I think it's the way that you present it. And
Yeah.
then when you get buy-in, because so many people are in this pre-contemplative stage that they don't even know this exists. Like they don't even know that there's another way besides taking pills and swallowing pills in the morning and
Yeah.
feeling like crap, right? So then you get them to the contemplative state, and I would recommend, like, hey, do you ever watch any TV? Pretty much everyone says, yeah. We just sit on the couch, watch TV. Great. We'll get some Netflix, I'd love for you to watch. Why don't you, watch these couple of Netflix. Next time you come back, let me know what you think. Or, hey, do you like to read? Okay, I've got these books, or listening to on audio. Or do you listen to podcasts? I'm like, I love podcasts. It's like free education for me. Like I can just put that on when I'm driving or maybe taking a walk, and I can learn. Oh yeah, I love podcasts. Okay, I'm going to give you a couple of podcasts. So I had like a resource sheet that I
Yeah.
would give them. And then I even had it in, we used Epic when I was with Trinity, and I had smart sets, like, smart phrases, put that into their note,
Hmm.
highlight. I think you would love this. So I think it's giving tools
Yeah.
and knowing how to do that. And you'd be surprised at what people are able to,
Yeah. And
do
then I
if you give
guess
them
if
the
you
opportunity.
focus on the wins, the ones you really do connect with,
Yeah.
and not so much
Yeah.
on the,
Yeah.
however tons who just
Yeah.
want the pill,
Right. Yep.
right?
Yep. Yep.
Um,
Yeah.
so all right, so we've been talking for a while. I want to hear what you said your interest
Yeah.
was piqued and you went
Yeah.
home.
Yeah.
No.
Yeah. And I think there's a time in life where my kids were in college, now they're out of college, they're adulting, and you get in your 50s and you're like, okay, like I've had this experience, I've gained wisdom. My life is set up that, I couldn't have made these I wouldn't have made these same choices or transitions if my kids were in middle school and high school, and I
Sure.
was like,
Right.
missing out on things. So in 2020, early 2022, I made the decision, you know what? I have an opportunity and I'm going to transition out of conventional medicine. So I went to work at Canyon Ranch, which Canyon Ranch is
Which I
an
love.
amazing wellness resort. Really, um, was just at the forefront of what an integrative wellness resort could look like.
Hmm.
And the founder, Mel Zuckerman, just really had this vision, and very incredible. So the original Canyon Ranch was in Tucson, Arizona, still there. And I was in the Berkshire Mountains in Massachusetts, and went there. It was one of these, like, I felt like Thelma and Louise, but it was just me. I packed up my little Ford Escape, and my husband, works remote, but he coaches soccer, and like that's really,
Yeah.
and we have two dogs. So we're like, okay, I'm gonna buy a little house there, and we're gonna kind of do this back and forth thing. And packed my car up,
Melissa,
drove out to
Melissa,
Massachusetts.
I have a house up there also. I
Oh,
have
you're
a house
kidding me.
in
Yeah.
Otis, and I love it. I've never
Yeah.
actually gone to Canyon Ranch, and I've
Oh, you
been
would
to
love it. Yeah. So
Kripalu and Miraval, but not
yes.
the Canyon Ranch. So
Yeah, it's beautiful. So my house is in Lee, just down
okay.
the road from Otis. And I didn't know a single person, and I was like, I'm doing this. And so Canyon Ranch has an integrative team. Like it's just, I mean, Miraval is wonderful too, but when you look at the offerings in Canyon Ranch, so we had two lifestyle medicine physicians,
Hmm.
we had exercise physiology, we had sports medicine, nutritionists, spiritual health, mental health, health coaching, just classes. And
Yeah.
um, it was an amazing opportunity for me to learn how to work with an integrative team. We did things that were beyond what I did at conventional medicine, like under that roof. I mean, we could do EKGs, pulmonary function tests. We utilized continuous glucose monitors. We had a DEXA machine, so not only bone density, but we could do body composition. Um, we would do overnight sleep studies using watch pat system. We would do extensive blood work. So I really gained a lot of
Yeah.
knowledge and tools. And all of the providers there also gave educational lectures. So 3 times a week, I would give lectures and presentations to the guests there. So that
Hmm.
really helped me with my presentation style and building out content, which I've been able to, really build upon. So an incredible experience. After a couple of years, it was like, oh, I miss home, and it got to be a little bit difficult
Yeah.
going back and forth. So just when I was thinking about, golly, I really need to get back to Michigan, an opportunity uh, presented itself, just like life, once you're open to this, I think
Yes.
some opportunities can come your way. So I joined Lifespan Medicine. We are a concierge practice. We have offices in LA, Dallas, Miami, and then probably opening one in New York City in the future. And I work hybrid. So I do telehealth. Telehealth has really shifted so many things and collected a bunch of, I now am licensed in 8 states. So I had to do all of that to get licensed. And then I fly to usually the Dallas office a couple times a month and see patients in person. And we really focus on, I would say like I'm an internal medicine and 3 other physicians. So the 2 of us are internal medicine and then 2 are family medicine. So we come from a conventional training background. And we've had, my colleagues are absolutely brilliant and have worked for Cleveland Clinic and Osher Health and just really top-notch health systems. So that's our foundation. And then I would say it's a Venn diagram of integrative medicine, lifestyle medicine, functional medicine, under really promoting not only longevity, but increasing our individual's well span or health span. And we've got a couple of nutritionists who are brilliant, and we have sports medicine. So we're able to offer things like PRP and red light therapy and really exosomes and just really some interesting modalities out
Yeah.
there. So I am learning a ton. It's I think to be a continuous learner, there's nothing better.
Yeah.
And just coming from, medical school where you're just like, okay, there's one way or the highway. I'm like, oh my gosh, there's
Yeah.
this whole other world out there. And really, I still believe there's some fancy things out there, maybe not fancy. There's some things out there, but fundamentally, you need to have a foundation of lifestyle medicine, right? Of
Right.
your pillars of lifestyle. So that would be food is medicine, like your mom said, and moving our bodies every day and restorative sleep, stress management tools, social connection, avoidance of risky substances and risky behaviors. And then, of course, there's 6 official pillars of lifestyle medicine, and I'm on a quest for a 7th pillar of daily exposure to nature and fresh air.
Yes.
And I think that, really my advice to anyone is like, go for it. You've got to make sure it's the right time in your life. And like I said, I wouldn't have done this when my kids were younger, but once they had their wings and, I let my little birds go, then I'm like, just go for it. And the worst that can happen is someone says no, or you get ignored. So that's what I've just found. Uh, and I've really just connected and networked and just put myself out there
Yeah.
authentically. And I think that's really important to show up because I've always loved nature. And then one day I was like, I'm going to submit an abstract to the annual lifestyle medicine conference of 2,000 people about nature's medicine. I'm like, what do I have to lose? Somehow I got accepted, and I was on the big stage. They had like multiple stages, and my presentation was immediately following Dr. Dean Ornish and Dr. T. Colin Campbell. T. Colin Campbell wrote the China study. So 2 of the biggest luminaries
Uh-huh.
of lifestyle medicine, if not the biggest luminaries. And I'm in the back of the room of this huge convention center. I'm like, deep breaths. Okay, 10 deep breaths. Bring your heart. Okay, like and I got up on that stage and I'm like, and I'm Dr. Outdoors, so and I got such great feedback and such a great support and interest that it led me to be the founding chair of the Naturist Medicine Committee for the American College of Lifestyle Medicine, where I have built up this wonderful committee. I have a co-chair and a secretary. We play around with Nature's Medicine. So we're the NAM sisters. So we'll talk, we use NAM as an acronym. And each month we host a webinar for anyone who's a member of the American College of Lifestyle Medicine who can join. We have like 11,000 members, and we bring in guest speakers from all over the world. And it's been great. And I've gotten opportunities to speak and share this message all over the world. A couple of us from American College of Lifestyle Medicine spoke in Saudi Arabia. I'm speaking in Portugal. I'm having a blast. And again, it's just showing up and finding something that resonates with you and coming it from that place deep in your heart of like, this is who I am.
Yeah.
I'm not faking it, right? I'm not trying to be someone else, and
Mhm.
then going with it. And it's really been a true journey and a true ride. And just these funny stories of told you how, like, I can't believe that I'm a DO and I'm Dr. Outdoors, and that's so perfect. Years ago, in like 2010, I had actually a baking company, or like a little small business. And I'm going to tell you, I know we're running short on time because we could talk forever. But my daughter was she ended up being a diet. She dove in college, D1, but she was a gymnast to start with before she started diving. And she's like 8 years old, and she came home from practice one day and she said, "Mom, I am going to do great at my meet tomorrow." And I was like, "Well, of course you are." And I said, "Oh, yeah, okay." She's like, "You know why?" I said, "No, tell me." She said, "Well, at practice, one of her older teammates told her to open up her mouth and she fed her something imaginary. And she told my daughter, Paige, you are going to do great tomorrow because you just ate some fresh baked confidence. And now that
Oh,
confidence is inside of you. And that's just all you need for tomorrow." And so I loved this saying of fresh baked confidence. So I partnered with another physician who is pediatric anesthesiologist who loved to bake. So we started a business called Fresh Baked Confidence, and we made healthful treats, and they were packaged with motivational sayings, kind of like a
oh,
fortune cookie. But anyways, so back then, this is 2010, she was chief baker and I was chief motivator. So I got a Gmail for this business, and it was Motivator Melissa. So, and then we did that for a couple of years, and it actually just grew too fast. And we're like, we're just two physicians. We don't know how to do this. We don't have time. But I kept the Gmail Motivator Melissa, or no, maybe I didn't even have the Gmail. I had the Instagram. And now that's like my handle is I'm Motivator Melissa. And that all came from like a baking business in 2010, where we were trying to motivate people. And I
uh-huh.
was like, I'll be chief motivator. So you never know, but
I
these
love
these
it.
early steps of you just do it, and then 10 years, 15 years down the road, you go, wow,
All right,
it's pretty
timing
cool that
wise,
I did
Melissa,
that. And
do you have a prediction with your crystal ball of how many years it's going to take for what you're currently doing to be mainstream and covered by insurance,
ooh,
if
it's a
ever?
hard question. I mean, we are going to have to see the shift to value-based,
Yeah.
care. We really are. And stop incentivizing procedures and product in primary care productivity, right? RVUs and things like
Mhm.
that. Gal, I mean, I'm hoping in a decade that
Yeah.
we're going to see a shift. We're already seeing it in education. There's lifestyle medicine interest groups in medical schools. There's lifestyle medicine interest groups in residency.
Hmm.
So we are seeing a shift, and I think it's going to take those young ones,
Yeah.
those young, really smart ones who are like, this is how I want to practice medicine,
Yeah.
right? Um, and for large healthcare systems, I'm excited to see what Blue Zones Health is going to do, because they've got a presence. Dan Buettner has done a great job of getting the public, the layperson, to really be interested in longevity and what that looks like. People, 5 years ago,
Mhm.
no one had a clue what Blue Zones were. Now he came out with his docuseries.
Yeah.
I think that some of these, Peter Attia came out with his book. There's just people are taking an interest into this,
Yeah.
and they're wanting, and I've just seen the demand for lifestyle medicine, the demand for integrative medicine or functional medicine is just the consumer wants it. And I think that's what is going to help shift this, is when the
Yeah.
consumer is asking for this and demanding this.
Hmm.
I think we're really going to see this shift.
Yeah. All right, Melissa. So how can people find you if they want to?
Yeah. Yeah, so I've got two Instagram handles. So I am at Motivator Melissa, also at the Doctor Outdoors. I do a lot of content. I love doing just impromptu videos. I'm also very active on LinkedIn. So Melissa Sundermann on LinkedIn. Come find me. And my intern is working on my website right now. So don't have that quite yet,
Awesome.
but find me on LinkedIn. I'd love to connect with you. And catch me on Instagram.
Well, thank you for bringing your passion and energy to this conversation. It was a true, true pleasure.
Thanks for having me.
For this episode of Reinventing the White Coat. If you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. internist.com. Thanks for listening, and don't be afraid to live your best life.